That way you can advance. There you go.
Hello, welcome everyone. I want to welcome you to the Value of Recognition, Sharing Successes. My name is Jennifer Williams and I'm a clinical program specialist at AvaSure. So today we're going to talk about how you can recognize your team and share your program success. So the first thing I wanted to talk about is the value of positive recognition. And I think that we all know that positive recognition in the healthcare setting and workplace setting can improve buy-in in whatever program that you're trying to accomplish. So you can create trust and encourage program participation as well. As you increase your program participation, you will also increase utilization. Your staff will begin to think AvaSure first, and then you'll see a improved impact on your program. Sharing positive recognition can also improve program performance. As your clinical staff and monitor staff are recognized for what they're doing within the program, then they often want to build upon program performance. It can also promote teamwork and motivate healthy competition. As your staff see each other getting recognition for the good things that they're doing and impacting safety, they're going to do those things as well. Improving staff relationships and staff satisfaction can also be a great of positive recognition. So a couple of things I wanted to talk about. A great recognition opportunities are sharing your great catches for your program, of course. I know we advocate about this a lot, but having your monitor staff write down their great catches and sharing them amongst staff and leadership is a great way to show how your program is impacting everyone. Events avoided is also another great one. You can get this from your export feature and from Orna if you have a subscription to Orna. And that allows you to identify how many events that you've avoided with your program, which is a great way to show impact. So some ways that you could share this information is through your intranet if you have one. If you have an intranet, you could even create an AvaSure page, which would be great, so people could access that when they wanted to. Hospital newsletters is also a great way. If you already have a newsletter, you could create an AvaSure corner or a great catch corner and utilize this area to share great catches. I do have an example of a great catch here, which is a great one regarding workplace violence, where a patient was becoming aggressive, the monitor staff was observing, and the nurse was feeling cornered. So they were able to recognize this behavior immediately, prevent injury to the nurse, and get immediate help from staff and security. So that's just a great, impactful story that helps us identify how your program is working, and sharing that with individuals and recognizing the monitor staff that was able to avoid such an event is just a great way to impact your users. Your department bulletin board and common areas is also a great way. You can print off great catches, type them up on the computer, however you want to share them, and just put them in common areas so people can read them. And then also at your safety huddles, where you're getting together anyway at the beginning of the day or in the afternoon and talking about AvaSure and utilizing your devices and identifying appropriate patients. You could also share a great catch or share how many events have been avoided for that week. So great ways to share. Potential recognition awards. Some of our hospitals have utilized some of these. Fastest runner award or stat alarm response time. So that's identifying the care unit that has the fastest stat alarm response time. So it's responding to those safety events in a timely manner. You can also drill that down to individualized people if you wanted to as well, and just recognize your fastest runner. So just a great way to recognize that response. Units is a great way to promote or motivate other care units to utilize more by recognizing those units that are utilizing the most. And then, of course, program monitor staff or clinical staff of the month. So this is a great way to build relationships between your clinical staff and your monitors by recognizing them, identifying how they're contributing to the program. You could have a monitor staff introduction corner in any of the previous mentioned ideas above. The monitor staff are always responding to program needs when they arise. So staff recognition can also lead into staff education, of course. So I do an example here of being able to drill down, pull out monitor staff information from your export. You can see in the table to the right, we have our row labels, which is your monitor staff initials, and then you can see stat alarms that set off and deactivate within the time frame that you've chosen to export, their verbal interventions as well, and then a grand total. So this is a great way to export, analyze your data for your monitor staff. This helps build staff rapport, as you can use this information as well to show clinical staff how your monitor staff are responding and communicating with patients. It helps your monitor staff understand their performance. How are they performing with are they utilizing enough? Are they do they need to utilize more? How many stat alarms do they typically set off? It also helps them recognize intervention impact, seeing how many interventions they're providing and how that is impacting patient safety. They'll be able to connect patient support to their relationship building and the rapport that they're building with their relationships, and how their interventions and support are helping keep the patient safe. It promotes patient responses to interventions. Typically, the more the monitor staff communicate to the patient, intervention. So this is a great way for your monitor staff to see that if they're having good responses when they're talking to their patients, that it's probably because they're creating that relationship and building that rapport with them. This is also a great way to identify performance. So utilizing the in your competency reviews and being able to recognize your staff for the program impact. Sharing program success with data. We want to make sure that we're sharing program successes. One of the biggest things is that we want to ensure that we're sharing it at all levels within your organization. So we want to share from the executive level all to that frontline clinical floor staff. Doing so promotes program awareness. It gets your clinical staff thinking AvaSure first. It lets your leadership and executive level staff know that the program is working well and is impacting patient safety across the system or site. It improves program knowledge, so it allows people to see how the program is doing, what the program actually does to help keep patients safe. It provides that data support and metric support to show how the program is impacting your hospital. It engages your clinical staff and your leadership. For those who may not utilize the devices as much or be involved in the as a program is, engage them in the program, gets them thinking AvaSure first as well. This can also support process executive leadership and frontline clinical staff know what's going on with the program. Allow people to provide ideas on how we can improve workflows and visualizing the patients and how the monitor staff feel about how things are going on the front line as well. So this is a great way to create that communication portal for everybody to talk about process improvement and continually improving your program. It can also highlight program impact. So knowing that the program is successful, knowing that you're having a fall reduction or a sitter reduction, and knowing that you're having a financial impact for your hospital site. And so with everything that we've talked about today, sharing successfully, we know can sometimes be difficult. Everybody has more than one thing on their plate, and we know you don't always have time to get in and look at your data. So here are some great tips to help you share successfully. Setting aside time to review your program metrics on a regular basis is a great way to make sure that it happens. Putting some time on your calendar in certain intervals, knowing that you need to take some time to look at your data, whether it be export or Orna if you have an Orna subscription. Identifying recognition opportunities, always having a lookout or an eye out for those great catches, or knowing what metrics that you want to share on a regular basis. And speaking of what metrics to share, if you don't already have a recognition program in place, I do recommend that you start small and add more later. Don't go out and try to share every metric for your program all at once. If you're just trying to get started, start with those small little metrics that we talked about previously, like just sharing great catches, sharing your events avoided, and see how that goes and do that on regular intervals, and then add more, then share a couple of metrics one month and then share additional different types of metrics next month. And that's just a great way to cover all of your metrics within your program. Determine a time frame that you want to share. Bi-monthly, monthly, every other month is fine as long as you are sharing your information. Do weekly if you have time, but just picking that time frame that will work the best for you. Designating an individual to assist with program data and your recognition and sharing. Like we talked about before, we know you don't have a lot of time. If you're one of those hospitals that have analysts or a quality department that can help you out, that's amazing. But if not, you can look at possibly education, just helping you disperse the information and provide it to the frontline staff and the monitor staff, or even unit level management, owning their own data and identifying where they can share and recognize their own staff. And finally, if you reach out to your AvaSure clinical program specialist, if you're a current customer, we're always willing to help. If you are not a current customer, you can always reach out at info.avasure.com or just go to our website for more information. So that concludes my presentation today about recognition and program success. I do have a couple of questions that I am going to read and answer. So the first question is, can you give an example of a great catch you have heard and that was used in a positive way? So yes, we have a lot of amazing great catches, and I know I provided an example in the slides, but we do get a lot of great catches in regards to actually patient condition. So recently, especially with COVID and everything that's been going on with that, I've had a lot of great catches where a patient's condition is noticed to be deteriorating. So I've had a recent one where a patient actually removed their BiPAP and desatted down into the 70s. And the monitor staff was the first person to recognize the patient having issues and was able to call staff into the room and get immediate treatment for that patient. And so that site does share their great catches, and just sharing your great catches puts a positive impact on your program, letting others know that if that patient would not have been caught when they were desaturating or noticed that their BiPAP was off because there would not have been anybody in the room, that there could have been a poor outcome for that patient. So that's definitely a great way to share great catches in a positive way. So the next question is, can you talk about how great catches and recognition can improve relationships between the nurse and the monitor staff? So improving relationships between the nurse and the monitor staff just kind of happens naturally. So you're sharing those great catches. The clinical staff are hearing about them. We often find that the clinical staff don't really understand what goes into what the monitor staff are doing. So sharing the great catches gives them that bigger picture. What are they doing for my patient besides just watching them through a device? They're actually recognizing behaviors. They're seeing your patient's condition. They're able to be proactive and make sure that your patient is safe. So that in itself helps create that relationship. And there is the third question is, what are ways that other hospitals have introduced monitor staff to nurses, especially in a hub spoke setting? So that's a great question, because when you're in a hub spoke setting, it can be kind of difficult because you guys are separate and you are in different buildings. So some great ways are to have an open hub that are close enough to come by and visit, walk through and do an open house and see what happens with the monitor staff. Another way is to do a video open house. With all the technology that we have today, we have some hospitals that have done a FaceTime and just walk through the monitor station, allowed nurses to see what goes on at the monitor station, and to just kind of get an open view of that area. And then another great way is something that I mentioned before is just having interactions of the monitor staff, because since you're separate, you have a hub and you have spoke, they don't always know your monitor staff personally. That can be difficult because they might be employees of the other hospital. So just having a introduction of monitor staff through a newsletter or through your intranet, and talking about great catches that monitor staff has had, or just sharing some information about your staff is a great way to introduce the monitor. Is what are ways we can track events that did not happen on device? So that's a good question as well. So you do have your events that occur on device, and you can track those as they occur. A great way to do that is having a steering committee, or a fall safety committee where you talk about your falls or events that occur off a device, and talk about why it's occurred, and why was a telesitter not considered, or if it was, why was this patient eligible for place in a sitter? Was it because they were waitlisted? Was it because they didn't criteria? And then you can look at all of that information, and you can work on tracking and finding those patients that had events off of the device, and identify maybe what patient populations you're missing when you're looking at patient selection for patients that go on a device. Next question, what would your focus new man a lot of staff turnover? Okay, so if you've had a lot of staff turnover, we do have some recommendations and some information on how to train new monitor staff. If you're talking about monitor staff turnover, if you're talking about clinical staff turnover, that's just going to be difficult, as we know that some there. But as a new manager, I would make sure that you are promoting awareness for your program, make sure everyone's aware of the program and what is going on. We do have our e-modules that you can set all of your staff. We do also have abundance of resources that we provide you. You can also incorporate program information into your orientation if you're talking about your clinical staff. If you're talking about monitor staff, we just need to make sure we're putting them through a good orientation, letting them view patients and observe another observer so that they're getting that experience. As a monitor staff member, nurses, what can I do? So a good way to approach that is just to always stay positive when you're talking to your nurses. I know sometimes on the clinical floor, they can get stressed out, and so that can come through in their communication to you. If it's an ongoing problem with, one or more nurses, you may need to just have a conversation with that individual and ask if there's anything better that you can do to help them through the concerns that they're having, or you may actually have to bring in your leadership to help you work through that issue. But I think the thing is to always communicate, always stay positive. If your clinical staff aren't giving you enough information or communicating appropriately with you, and that's causing you to maybe not be as knowledgeable about your patient that you're monitoring, then you can work with them and be proactive and ask more questions that information, but essentially just stay positive, try to communicate with them. Hopefully it'll improve over time. Next question, how often should monitor staff communicate with nursing staff? When is it best to use the stat alarm or call the nurse? So communicating between monitor staff and clinical staff should at least at minimal be happening at admission and discharge. It's also recommended that every shift there is an update or at least a touch base about the patient, that you can get any additional information or condition changes or change in the patient since the last shift. So I would say at admission, discharge, and then at least every shift. And then of course, if there's a condition change or something in between, then it's nice if the clinical staff would call the monitor station and let them know as well. The second part of that question, when is it best to use the stat alarm versus calling a nurse? We always like to say if the patient seems to be in imminent danger of an event or an injury or something that's going to impact the patient, you're going to want to use that stat alarm. If you have the ability to contact the nurse before that patient is in any imminent danger, then definitely try that first. Another rule of thumb is to communicate with your clinical floor staff and ask them when they would prefer to be contacted over use of the stat alarm. But in any case, you would always use the stat alarm if the patient's in imminent danger. But knowing specific things about your patient, like whether they're allowed to sit at the edge of the bed, whether they're allowed to get up and go into the bathroom themselves because they're an ambulatory patient, those types of things are communication that you need to know about your patient in order to care for them appropriately. So nobody but the monitor staff can really say when it's the most appropriate to use the stat alarm, because you're the ones that are in control of how safe that patient is. Next question is, are there easier ways to share data with hospital leadership or my monitor staff? So a little more information for that question, because I'm not really sure if you're a site that has Export or Orna. But if you are an Orna subscriber, the easiest way to share is to print off your landing page and share that information. That's the quickest and easiest way. But really, if you're you just have to take the time to sort through that and find the data you want to share. You could send out monthly emails, like a bulletin of certain metrics if you wanted to. That could make it easy so that you could share it with the individuals that you wanted to. And sharing with monitor staff, a great way for them is just to hang up metrics and information and program data at the monitor station. I do see a lot of hospitals doing that. And that's nice for monitor staff because they know they can just come in and look at that information when they're working their shift. All right, next question. On the opposite side, if adverse event, how do we handle this in a way that is constructive and a good learning experience? Okay, so that's a great question. Not always going to prevent every event on device. Things are going to happen and you are going to have events on device. So a way to use that constructively is to definitely do your event investigation, use the data that you have available to see what occurred. Was it a case where the patient was just very impulsive? Was it a case where there was multiple things going on with the monitor staff and other patients at the time, and that patient was just not seen? So we want to identify what the root cause of that event was, and then learn from that experience. So I really think that doing an event investigation, looking at how can we prevent this in the future? How can we be more proactive? If this same instance were to happen, how could we prevent that from happening in the future? Okay, next question. We have not gone live yet. What steps would you take prior to implementation to ensure a good experience? So we do have a well-defined implementation process here at AvaSure. So there will be a lot of resources and information at your fingertips when you start that. But one of the main things that I found in implementation is just making sure that you take the time to identify how you're going to set up your program, identifying, how you're going to hire your monitor staff, and just making sure that you have all of that support at different levels. So good leadership engagement, making sure that you have designated people to help run your program when it goes live. So setting a good group of people to work the implementation together and then move forward into the program after go live is going to set you up for success. Next question. If you only have the time or ability to make small changes with the Telesitter program, what would you focus on? That's a great question. So if there was one thing that I would focus on in any program, it would be the gatekeeper process. So identifying that individual that helps you through patient selection, helps you identify appropriate patients that need to be on the device, helps you triage those patients on a regular basis. And just making sure that you have a good gatekeeper process in place. So that could be your supervisors, your unit managers, any of those types of individuals that help with sitter allocation or will be able to access that dashboard, the AvaSure dashboard on a daily basis to triage patients would be where I would focus. Once you have a strong foundation and a good gatekeeper in place, your program typically will run very smoothly. So if I had one thing to work on in most programs, I would focus significantly on your gatekeeper process. So I think we're just about out of time. If I was unable to answer your question during this Q&A, we will attempt to reach out and answer the questions after the program. So I'm excited that you guys joined today, and I appreciate it. And so next we are moving on to managing innovation and seeing active results through change agents. So I hope that you join that presentation and continue to follow through and watch the AvaSure Symposium. Thank you and have a great day.